In the year 1918, the world was still echoing with the thunder of war, but a new, silent enemy was already rising. It came not with gunfire, but with a whisper in the breath of every living soul. The influenza pandemic, a storm that would circle the globe, take millions of lives, and change the course of human history forever. Tonight, we journey back to that moment to understand not only what was lost, but what humanity learned when silence fell upon the world. This is Whispers of History, calm stories from the past to ease your mind. In the early months of 1918, as the world was still consumed by the Great War, another enemy was quietly awakening. It was invisible, silent, and it moved not with weapons, but with breath. The influenza pandemic of 1918, later known as the Spanish flu, would become the deadliest outbreak in recorded human history. Scientists believe the virus was a strain of influenza A, subtype H1N1, possibly of avian origin. It appeared suddenly among soldiers in crowded army camps and hospitals, spreading with frightening speed. Because the world was at war, troops moved between continents, and so did the virus. Ships and trains carried infection to every corner of the globe. In the spring of 1918 came the first wave, mild yet widespread. Soldiers coughed in the trenches, civilians fell ill, but most recovered. The world took little notice. Then, in the autumn, the virus returned, changed, more deadly, relentless. Hospitals filled. Entire families fell ill overnight. Coffins ran short. Within months, the pandemic reached Asia, Africa, Europe, and the Americas. No continent was spared. The press in neutral Spain reported the outbreak freely, and so the world called it the Spanish flu. Yet Spain was not its origin. It was simply honest enough to tell the truth. By the end of 1919, the disease had circled the globe 3 times. It would infect an estimated 500 million people, 1/3 of humanity. And between 20 and 50 million would die, many in the prime of life. Thus began the whispered story of the deadliest influenza ever known. The impact of the 1918 influenza pandemic reached far beyond its staggering death toll. In cities and villages, fear walked the streets. People closed their doors, isolated in silence, waiting for the fever to pass. Schools shut down. Churches stopped gathering. Markets emptied. The illness struck without mercy. The young, the strong, the soldiers returning home from war. In the United States, more than 675,000 people died. Across India, millions perished within months. Hospitals were overwhelmed. Nurses and doctors fell ill, and families were left to care for their sick alone. In many towns, there were not enough coffins, not enough graves, not enough tears. Economies collapsed. Factories closed as workers lay bedridden. Ships stayed in harbor. Trade slowed to a whisper. The world, already exhausted by war, now faced invisible devastation. Yet from that suffering, medicine began to change. Researchers studied patterns of infection, realizing the need for global surveillance. Public health became a science of its own, with systems for tracking disease, sanitation, and communication. The pandemic revealed how fragile life was and how vital cooperation could be. Even after the flu faded, its shadow lingered, in families torn apart, in economies reshaped, and in the hearts of those who survived. Facing a crisis they barely understood, nations searched for ways to respond. Doctors had no vaccine, no antivirals, and antibiotics were still years away. They relied on simple tools: isolation, masks, and faith. In cities like Philadelphia, parades continued, and the flu swept through crowds like wildfire. In St. Louis, where officials closed schools and theaters early, death rates were far lower. These became lessons in the value of timing, the power of acting early, even without perfect knowledge. Masks were sewn from cloth and gauze. Public notices urged citizens to cover their mouths, wash their hands, avoid crowds. But fear and fatigue often led to resistance. Meanwhile, governments censored reports to protect wartime morale. Newspapers spoke softly of mystery fevers, even as hospitals overflowed. Yet amid the chaos, acts of heroism shone. Nurses walked miles to reach the sick. Volunteers carried food and medicine to families in quarantine. Communities, though divided by fear, found compassion in their darkest days. When at last the virus ebbed, the world emerged weary but wiser. The importance of public health, communication, and early action was etched forever into history. More than a century later, the 1918 pandemic still stands apart as the worst influenza outbreak the world has ever known. Its reach was global, its speed unmatched, its mortality terrifying. Later pandemics, the Asian flu of 1957, the Hong Kong flu of 1968, killed millions, but none approached the scale of 1918. One of its strangest features was who it killed: young, healthy adults, soldiers in their 20s, mothers in their 30s, teachers, farmers, workers, all cut down in their prime. Scientists later learned that their strong immune systems may have overreacted, creating deadly inflammation, a cytokine storm that suffocated the lungs. The virus's emergence during wartime magnified its spread. Crowded barracks, trenches, and ships turned into incubators. In this way, the flu was not just a biological disaster, but a mirror of the human world, revealing how interconnected and how vulnerable we truly were. Even now, the lessons of 1918 shape global planning. Every pandemic blueprint, every vaccine network, every outbreak model owes part of its design to the ghost of that year. It remains the yardstick of catastrophe, a silent reminder whispered through the decades. From the ruins of 1918 rose a new awareness that health is global and prevention is power. The first lesson: detect early. Diseases know no borders, and every hour counts. The second: communicate clearly. Silence and censorship cost lives. The third: prepare always. Build strong health systems, support research, and trust science even in fear. The 1918 pandemic also reminds us that compassion can survive even the darkest storms. Communities healed one another, strangers helped the sick, and humanity endured. In our modern age of vaccines and global travel, the ghost of 1918 still whispers. It tells us that progress without humility is fragile, and that history repeats when forgotten. So tonight, as you listen to this story, remember, the worst pandemic was not only a tale of death, it was a lesson in life. The world changed because of it, and because we remember, we stand better prepared for the future. Whispers of history, calm stories from the past to ease your mind. When the great influenza finally faded, it left behind more than sorrow, it left wisdom. A reminder that life is fragile, that our breath is shared, and that compassion endures even in darkness. The whispers of 1918 still echo in every vaccine, every mask, every act of care. So as you rest tonight, remember, the past speaks softly, but its lessons never fade. Thank you for listening to Whispers of History.